You're ready, Jim?
All right, good.
Ready? Hello, here I'm Mr. Cruz at my house in East LA with my good friend from college, Dr. Lopez. He's going to tell us a little bit about COVID and the vaccine. So first of all, Mr. Lopez, could you tell them what you do and what's your responsibilities in the hospital?
Good afternoon, students. My name is Jose Lopez. I am a pharmacy director for a hospital in Southern California. And today we're going to talk a little bit about the COVID vaccine. So there's 3 different variations of the vaccine, 2 messenger RNA vaccines available and 1 DNA-based vaccine. So in short, the messenger RNA vaccines, they're relatively new technology. So basically what's happening is once you get the vaccine, it's building up your immune system to mimic the an active COVID vaccine, active COVID infection. So once your body recognizes those proteins that build immunity, once you get infected with COVID, or if you were to get infected with COVID, chances are your body has already produced an immune response and you have a negligible effect.
So you're saying that they don't even put the virus in you anymore. So like I know some people might be concerned about taking the vaccine.
No, it's not an active virus. So what it is messenger RNA mimics the virus protein. So your body, in a way, is getting tricked into having a COVID infection, but it's really protecting yourself against the virus.
You say it's pretty safe?
It's relatively safe from the clinical studies out there that have been conducted.
So do you get vaccinated? And if you did, why do you get vaccinated?
I've got vaccinated. Our hospital was one of the first places to get it in our community. So, as you know, senior citizens and the frontline workers were the first to on the tier of vaccination. So I got it as soon as it was available to the staff at our hospital.
And why do you get it? Like, what about your family?
At the time, if you think back, a couple months after the pandemic started, social distancing, and there was really no tools out there to fight COVID. There was a couple studies out there that had anywhere from, parasite medications, some oddball therapies out there that were supposedly like a COVID cure, but that was the only scientific evidence available at the time was the COVID vaccine.
Now for our students, right? Hopefully, they're thinking about getting it if they haven't done so. I know you have kids that are young. Once a vaccination for the 5 to 11-year-olds is, are you getting your kids vaccinated, and why?
Yeah, I have 2 children, 6 and 7 years old, so obviously they don't meet the criteria or the guidelines for vaccination, but as soon as it gets approved by the government, by the FDA, it would be, like I said, like the only tool available to help prevent this disease. You can wash your hands, you can wear masks all you want, but the scientific evidence points at the vaccine, and it's relatively safe from all the data out there. It's either
so you would trust the vaccine with your kids. You'd rather trust the vaccine than them getting COVID.
COVID is one thing, but then the long-term complications are something different. There's been case reports of like severe heart infections or severe lung infections that are secondary to COVID infections. So, chances are if you get COVID, you might recover in about a week, but you never know the long-term complications.
And after the vaccine was available, when you saw COVID patients in the last spike, what percentage of them do you think were vaccinated and what percentage were unvaccinated?
So we had a surge about 2 months ago, 2.5 months ago. And, part of my job at this hospital is to make sure we have the antivirals available, one of the few therapies out there. And we got to send a daily count to the state of how much we have on stock, how many patients we treated. So as you mentioned, I would say 95% of the population that got treated or got hospitalized for COVID in the last 3 to 4 months were unvaccinated. A couple did receive the vaccination, but they did not need like a severe level of care, like an ICU visit or whatnot.
So what will you say to the students at Hollenbeck Middle School about getting vaccinated?
You
Will
know,
you recommend it?
at this point, we're close to 18 months into this pandemic, and same thing happened with the flu vaccine, or the flu pandemic of 1918. It was 2 years before we got back to normal, and we're still here about 18 months, and we're on the right path, and the vaccine would probably be the closest way for us to exit this pandemic.
And in your expert opinion, is there a big difference between something like the COVID vaccine and some vaccines that our students have already taken, like the Tdap, the measles, or the flu vaccine?
There's a reason polio doesn't exist, because the majority, or if I'm not mistaken, everyone that attends a public school needs to be vaccinated for polio, and that's just an example of how vaccines eradicated a disease that was common many years ago.
All right, and this from a UCSB Gaucho, so you know that's legit information.
Yes.
All right. Could you do